Live line with us this morning, Dr. Robert Edmonson, heart disease specialist, amongst other things. There's good news out there about chocolate. Doctor, welcome to the program.
Well, thank you. Glad to be here. And there is good news. It's really not new news. It has been known for some time that chocolate has some potential beneficial effects on the cardiovascular system. It's a flavonoid in the chocolate, the dark chocolate, that's beneficial. And it's been known for some time. The correlation between atrial fibrillation, which was recently published and of interest, is new information, but all the risk factors that the flavonoids reduce are factors that contribute to atrial fibrillation. So it's not a surprise that it has a benefit in that regard. But it's also, there are other things that are very healthy for us that do the same thing, fruits particularly, without the side effects of the extra sugar. So chocolate in modest amounts, dark chocolate certainly is not harmful. It's potentially good for us, but it should be used in moderate amounts and emphasizing other known factors that improve our health, reduce the incidence of atrial fibrillation, obesity, lack of exercise, sleep apnea, high blood pressure. These are all factors that have a much greater contribution to atrial fibrillation than chocolates do. So it is important, but I think even information about atrial fibrillation in that term out there is important because it's such a common problem, and for a major degree is preventable.
Well, and I guess like so many other things, and you said it about 3 times, bears repeating, in moderation. It's like so many other things that we hear about. They may be marginally helpful or not harmful, but everything in moderation, right?
I think that's exactly right. And I might say that some of the things that we enjoy, like red meats and steaks, particularly in Texas, they all have the opposite effect of its antioxidants and the flavonoids. They have the opposite effect of enhancing oxygenation and have the reverse effect of the chocolate and fruits and things of that nature. So that certainly is a contributing factor to atrial fibrillation, which doesn't get much attention because nobody likes to hear it. So in moderation, that applies as well to the saturated fats and the trans fats that we tend to consume.
And as always, if you have questions about your heart health or have a family history, that first conversation should start with your primary care physician, heart disease specialist, Dr. Robert Edmonson. Thanks so much for your time this morning.